Hi, my name is Dr. Bonnie Key. I'm the Editor-in-Chief of JACC Cardio-Oncology and Associate Professor of Medicine and Epidemiology at the University of Pennsylvania. And I have the great pleasure today of sitting down with Dr. Clyde Yancy, who's a Professor of Medicine at Northwestern, Chief of Cardiology there, leads a wonderful division, and is also the Vice Dean of Diversity and Inclusion. Clyde, first off, I just want to thank you so much for your tremendous support of JACC Cardio-Oncology. It's been wonderful, and also of all of your support of my own career. I know I've shared this story with you, but we met many years ago when I was a young fellow, and your words really served to encourage and inspire me. So just thank you for that. I just want to start off by saying that.
So let me start by first humbly saying I'm gracious to you and about you for your kindness towards me, and to congratulate you for serving as editor of the inaugural edition of JACC Cardio-Oncology. I mean, what a lovely statement in a journey that still has no peak yet. You're moving in such a great direction, and so the joy I have as a mentor is seeing someone whom I've connected with evolve over time and become exactly what their vision might not have been, but now has become, and that's the great thing. So congratulations to you.
Thank you, Clyde.
I do like the idea, though, that we're taking the lead on bringing the vernacular, bringing the substance, bringing the perspectives of a new field of cardiovascular medicine to the attention of our readership. This is critically important. We know that more people are alive with cancer now than ever before, and they're experiencing the consequences of either their therapy or the accelerated risk for heart disease that comes with this. And so much like we're having to learn to interface with endocrinologists, thinking about cardiology and diabetes, now we're doing it with oncology, as we should.
Undoubtedly, and that is exactly one of my visions for JACC Cardio-Oncology, that it really does serve to inform the clinical practice and care of our patients. And in addition to that, a vision of mine for the journal is that it does serve to unite the communities of practitioners for cardiology and oncology in the entire community, and also serves to truly build that pipeline of young investigators and young clinicians who are hungry to make a difference. And I think one of the major ways we can do so is via mentorship. And I wanted to specifically talk to you also about mentorship and your thoughts about that in terms of not only at the very beginning stages, but along the entire journey of one's professional career, mentoring at all stages. What are your thoughts about the role of the mentor, the mentee, and just that relationship?
So let's think about three things about mentorship, and you're exactly right. I think it's a key element for success in today's world, particularly for the younger or the next generation of physicians. The first thing is that no one can be successful on their own. There might have been a time decades ago when sink or swim, you make it on your own, buddy, or not. That's no longer the case.
Yeah.
The world is too complex, the time constraints are too tight for anyone to think that there's room for faltering and being frustrated and fretful in your work. Having a mentor is the best path forward. That's clear. So no one succeeds without a mentor. That's the first thing. The second thing is the definition of a mentor changes, because in today's world, with the ability to use the internet, to use networking through a journal, through major meetings, to connect with people not at your own institution, you really have a denominator of mentors like there never was before. And so think carefully about who is saying or doing or writing something that intrigues you that possibly could be your mentor. So it doesn't have to be proximate to you in any sort of way. The third thing, though, that is really important, very few of us have the same mentor throughout our career. There is a mentor for every stage of your career. There may be someone, mentor, coach, that marshals your career throughout, but expect to make transitions, expect to change, and remember that it's a two-way street. So everyone needs a mentor. You can't do it on your own. The world has become a smaller place. You have many more choices for mentoring, and realize that mentors change.
Exactly, and it is also, I think, about a team of mentors. I know that that's been integral to my own career, just to have this network, this entire network. Well, Clyde, thank you again so much for the time and just for sitting down with me and just all that you've given over the past number of years. Thank you.
Well, my thanks to you and best wishes for the journal's success, and I'm right behind you to help you make that happen.
Thanks.